Hi, I'm Stephen Merks. I'm a podiatrist with Associated Podiatrists here in Madison, Wisconsin. I wanted to talk today about one of the more common conditions that comes into our office, which is heel pain, and one of the more common causes of heel pain and arch pain is plantar fasciitis. One of the things that I oftentimes like to do to assess benefits of arch support or mechanical control of the foot is a taping. Taping is something that people often enjoy and want to continue doing in the short term, oftentimes while we're waiting for orthotics or arch supports to be fabricated. So I wanted to go through one of the more common plantar fasciitis taping techniques that we do in the office. And I have one of my helpers here, Maria. She's been kind enough to grace us with her foot to use as our model today. Materials for this, we're going to use essentially athletic training tape, or I call it strapping tape, of 1 inch and 2 inch wide thicknesses. We're also going to use a 2 inch wide elastic tape. And then lastly, you can use pre-wrap, or I have a 2 inch gauze roll here that I'm going to use to be an underlay or a protector of the skin. So the idea behind the taping is to control the rear foot and to control overpronation by locking that down. And we're also trying to put a little slack in the plantar fascia by bringing the foot tightly, bringing the ball of the foot towards the arch and holding the arch up nice and tightly. I've kind of pre-cut my tape, but essentially what I did is I started off with my 1 inch tape, and I was measuring from the 5th metatarsal phalangeal joint, the bump on the outside of the foot, coming around to the bump on the inside of the foot, the great toe joint. And I've done 3 of these lengths of tape already. And then I've got my 2 inch wide tapes, and I'm running it from approximately midway up on the foot to about midway up on the foot. Before you start, you want to make sure that the foot is clean and dry. Tape typically does not like any lotions, creams, Vaseline, baby oil, anything like that. Everything is going to start on the outside of the foot, so that's nice and easy. We're going to start with the 1 inch wide tape, and we're going to secure it just before that bump I was talking about. And then as we come around the heel, if you're doing this to a family member, have them relax and hang loose, or if you're doing it to yourself, just let your foot fall. And we're going to crank up on the big toe, which is going to artificially shorten the arch, and we're going to pull that tape in nice and tight. Tape's going to typically feel tight at first, and that will loosen up quite a bit over a 20-minute period. We're going to do the same thing. We're just going to stagger the tape a little bit, overlap it a little bit, and we're going to do that nice little cranking maneuver here again. Okay. Then we're going to go to our 2 inch tapes. We've still got one 1 inch tape left. We're going to start at the outside of the foot, at the very edge of the heel, the very beginning of the arch. Secure that down, and we're going to crank up and in. And that's going to act as just a little truss to kind of hold the arch. And you want to try to minimize any wrinkles on the bottom of the foot. And we're just going to work our way up the arch here. Everything starting on the outside, cranking up. And then finally, our last guy here. Now that last 1 inch tape, none of us are perfect here. I probably came up a little high, but this typically will catch those loose edges along the sides. We'll still do that little cranking maneuver here. And so we've got one controlling the rear foot and pronation, and we've got one supporting the arch, taking a little tension off the fascia. And then I'm going to secure these loose ends with that final little maneuver with our pre-wrap or our gauze. And then we're going to use a little elastic tape here just to ensure that we don't get too tight or cut off any circulation coming around the foot here. Just like so. So there's our plantar fasciitis taping. I probably will be referring a lot of my existing patients to the website to take a look at this, but certainly a very powerful technique in the treatment of plantar fasciitis. Thank you very much.